Hey class, it's Miss Baldwin. I'm going to do your review for Intro 2 Week 4 for your tests coming up. So what do we need to know starting out? So what is fixed prosthodontics? So fixed prosthodontics is going to refer to your crown and bridge, okay? What are indications for prescribing these, okay? Supportive teeth have got to be healthy, and there has to be a suitable abutment, okay? Must be present to be able to do this. So what is used for inlays? The inlays are going to resemble the Class 2 restorations. It's going to cover a portion of the occlusal and proximal surfaces and lays inside of the tooth. Okay. What are our crowns? So a full crown is going to cover the whole anatomic portion of that individual tooth. And then you have a 3/4 crown, which is not going to cover the whole anatomic part of the tooth. It's only going to cover the prepared portion of that tooth, all right? And then we have fixed bridges, which these are going to be recommended either when one tooth or multiple teeth are missing in that same quadrant, okay? These are going to consist of several different parts. So you're going to have your units. So how many unit bridge are you going to have? Is it going to be a 3-unit bridge, a 4-unit bridge, a 5-unit bridge? And that just depends on the number of teeth that are going to be involved, okay? And then you're going to have your pontic, which is going to be the artificial tooth. And then you're going to have an abutment, which is the natural tooth, and that's going to serve as a supportive spot or replacement tooth for the anchors, okay, on the existing teeth. So an example would be your 3-unit bridge would have a prosthetic, and it would have 2 abutments and 1 pontic, okay? Then you have resin bonded bridges, also known as your Maryland bridges, okay? These are going to consist of the pontic with a wing-like extension from the mesial and distal sides, and it's going to be bonded to the lingual surfaces of the adjacent teeth, and it's going to support that pontic, okay? I would go over the sequence for crown and bridge just so that you know them and they're familiar in your head, so that you know the exact steps and process that it's going to take for those, because those are very important, and a lot of those steps will get missed or improperly scheduled whenever it comes to doing those, okay? Retention aids for crowns are going to be your post and core, okay? And the post is going to be used if a tooth has been treated endodontically, okay? And the tooth is non-viable for any retention. And then we know what an edentulous patient is, correct? An edentulous patient is somebody that does not have any teeth, okay? These are our people that we're going to do dentures or partials on, okay? So this would be an example of an acrylic denture. This is the upper, this is our lower, okay? We got to know about, this is going to be an example of a removable partial denture here, and it will just clip on, so it's going to replace these missing teeth here, okay? We need to make sure that we consider patients' dietary habits whenever we're trying to think about whether we're going to fit them for prosthetics. I showed you what the partial looks like. What are pressure points? So pressure points are going to be sores that patients are going to get when they're having these poorly fitted, could be poorly fitted, partial prosthetics in their mouth, and they're going to get irritated in the oral mucosa. They're going to have sore spots in there, and we need to get them in to have those adjusted ASAP. So you will get lots of calls from patients, and it's not abnormal. It doesn't mean anything's wrong with the denture, especially after you've just had one placed, especially if it's an immediate denture. It's going to need to be adjusted throughout that time as your gums are healing and shrinking down. That soreness and swelling is going to go away, so that's going to have to be adjusted. So that's not uncommon. It doesn't mean that there's anything wrong with the denture itself, or that it's not working, or it was poorly made, okay? Some home instructions that we need to make sure that we're letting our patients know is that having a new appliance in the mouth could increase their production of saliva. They need to make sure, and I don't know why, but patients will do crazy things. Don't put bleach on your denture, on your acrylic dentures, your partials, anything you're going to be putting in your mouth like that. You don't need to be bleaching it. And then you don't use actual normal toothpaste on acrylic appliances either. Okay, they should be taught how to properly clean those and soak them whenever they come in. And that'll be part of our job, making sure that our patients are educated and know when to call, how to take care of their prosthetics, and so on. So if y'all have any questions on anything, you can email me or Miss Matthews. Good luck on your test, and y'all are doing great. Hang in there, guys.